Hi, I'm Laura Bewer with CoachMeLaura.com and At Your Service Mobile Notary. And today I have the opportunity to share with you some of my experience and how I came up with some solutions to take care of issues I have with trying to grow my business in healthcare facilities. So, who am I? If you don't know me, I am a California notary since 2004, and I've performed over 30,000 notarizations. I have taught the California mandated training in the state of California for the NNA. I am a co-facilitator of a very popular TNT, Tuesday Notary Titans National Weekly Coaching Call with my co-facilitators, Bill Soroka and Carol Ray. I am the creator of LBP, Video Replay Library, and that's a library of training for general notary work. I am the founder and co-facilitator of the annual Notary Symposium, and I'm a professional notary coach. So now you know a little bit about me. What will I cover today? I'm going to talk about the challenges notaries face in either A, getting into hospital work, or B, when they're in there, getting the job done. I'm also going to talk to you about what are some of the solutions I've found to that issue and some of the details I need to be cognizant of so that I complete successful notarizations while I'm there. So when I go to a hospital, I face challenges, and some of those challenges are just the environment itself. But more specifically, I have issues with patients who are uninformed about notarization. I have hospital staff who are misinformed about notarization. And as a result, I may have patients that don't have a document, or it's not filled out, or they don't have ID, they're not alert and aware. There's just lots of different issues that will prevent me from completing the task. So how do I address both of those issues? First step is education. I decided that I wanted a successful notarization, so I reached out to hospital staff and said, hey, I would love to put on a 10-minute state-specific program for your staff regarding successful notarization in a hospital environment, free. I can do it in many different ways and formats, but it's been very well received in my area. Now, you would want to arrange this through your facility's Department of Social Services or the Director of Nursing. And you might want to check out their website to see who's in charge of that so that you can address them by name. And you could either offer, as I have, to go in live as part of their staff meeting, or in these days, you could offer it as a webinar, pre-recorded, or you could do it virtually live through a Zoom call. So lots of ways that you could provide that. So that is a way to make me stand out. It allows me to be different than other notaries who are just dropping off their business cards and saying, hey, I'd like some work, please. Instead, what I'm trying to do is to bring value and develop a relationship that's not transactional, right? I'll give you this, you give me that. I'm looking to see how can I help. Now, what's the second step? The second step is going to be to create a one-page summary of what's needed to conduct a notary signing. Now, this is important. This is the follow-up, and that's because they're not going to remember 10 minutes later. They're not going to go review it just before they walk into the patient's room. So they need something that's handy, a summary that they can pin to a cork board in the break room and pull off, or maybe you've got it laminated so it can be sanitized, and maybe it's even a PDF, and they decide how they want to use that. Consult with the facility to see which option works best for them. So let's talk about the training itself. How did this come to be? I didn't develop it on my own. I started it as I did it for myself in the state of California. But as I realized this is not just a California issue, this is a national issue for notaries, I decided to collaborate with many other NNA ambassadors. And I put it out there to all the ambassadors and said, hey, this is my outline. This is what I do. What else do I need to consider for other states? And I got a lot of feedback that I was able to incorporate into this training so that I'd have something that I could help other notaries develop their own state specific. So in today's presentation, you'll see it's branded. It has brought to you by At Your Service Mobile Notary. However, there'll be a downloadable version that's plain, and you can put your own company, and you can add or take out anything I talk about that applies to your state specifically. All right, because the idea is I'm going to give you lots of ideas about it and give you the structure and format, and then you're going to make it your own. So the important details to share with hospital staff are going to be, look, we need proper identification. We need a document that's filled out completely. We are not authorized to provide the document, nor can we fill it out for them or help them fill it out. If the document requires witnessing, that needs to be addressed ahead of time, and it's the signer's job to arrange for witnesses. They need to be alert and aware for me to work with them. And of course, if the staff is involved, that's likely going to be addressed for you. But if the patient is making the reach out directly, then that may be something you're going to have to determine when you're there. And then willingness to sign without coercion, without somebody telling them for the 18th time, this is what you're signing. They need to be able to have that, show that desire that, yes, it's my intention to sign this document. So let's start with proper identification. And you know, in 49 states, if you know the patient, great, you're already there. Of course, California doesn't allow for personal knowledge. We have to rely on an ID card. And of course, that would be your backup plan, because when you're serving the public, you probably don't know that patient, and you'll likely have to use an ID as well. Now, some states will give a suggestion of what a card might have, what elements, like a photograph or signature. Some states will actually give you examples of cards that they believe are reliable for this purpose. And some states, California among them, will give you a list that says these are the cards, no other cards will do. So follow your own state-specific requirement. Now, what if they don't have it or can't get it? Credible witnesses or a credible person is an alternative for most states, not all, but for most. In many states, that credible witness must know the notary. So again, that might be difficult, because if you don't know the patient, you may not know their friends. In states that allow for you to identify the credible witness via an ID card, or go to credible witnesses that you don't know and use ID cards, then that would be your method to identify your signer. And remember, there's going to be specific procedures for your state. For instance, in Florida, they actually have an affidavit for credible witnesses, a statement they fill out, and then you actually notarize the statement, signature and statement of the credible witness. So you're performing separate notarizations in that case. In California, you don't have to have an affidavit, a written statement. You'll give them the oath verbally, but you do have to identify and subscribe in your journal that information. And if you're in a state that doesn't require a journal, it's encouraged, then it's a standard of care and good idea to at least record the names of your signers and what kind of ID that you use to identify them. So now we've got them identified. Let's talk about the document. The most common two documents for which I'm called to a hospital setting are general durable power of attorney and advanced healthcare directives. There are other ones I handle as well, but I would say 80% of the time that's why I'm being called there. On occasion, it's a last will and testament, and if it has a self-proving affidavit, that's the part that I'm likely notarizing, since wills on the whole are witnessed rather than notarized by themselves. So it's the signer's responsibility to obtain it. Now, they might be able to have social services assist them with that, to print it off for them, or they might have copies of that. And then it's the signer's job to fill it out, not to wait for the notary. All that should be left for the notary is signature. So that should already have happened before I get there. And sometimes of their own accord, they think, oh, I better wait till the notary comes. If you're talking with that signer directly to make that appointment, clarify with them right up front. Do you have the document, and will you have it filled out before I get there? Those are things I can't do for you unless you happen to be a paralegal or an attorney who can do that for them. So they're going to have it, and if it's the staff, that's why we're training them, so that they know to let that person be aware that they need to have that ready for the notary. Notary is going to check for completeness, not accuracy. So it's not our job to fix anything that may be wrong with their document. We're looking to see, did they fill it out? Now, there are going to be in these documents particularly optional sections where they don't want to put down their doctors, or they don't want to answer organ donation. They don't have to. However, it should be addressed, because if you just leave it open, somebody else could modify it after the fact. So they could strike through it, they could put N/A, they could put no, they could do anything they want to address the section so that it's not left open. So let's talk about a section that may be there. Maybe the document has a place for witnesses, but they're not going to use witnesses, they're using a notary instead. Then that area should be struck, or N/A, it needs to be addressed because they're not going to be filling it out. Let's say that, yes, they're going to use the witness part, but they don't have the witnesses there. Then we cannot proceed with the notarization, because the witnesses are there to witness the signature, not come in and sign after the fact. It could work the other way around, where they pre-signed it with the witnesses signed their area, and now I, the notary, come in after the fact and take their acknowledgement that they indeed signed that document. Now, that witness can be any impartial person, and of course that means you're going to have extra people in the room. So they'll need to talk with the hospital to make sure they can accommodate extra bodies in their room. And it's the signer's job to get those witnesses, to arrange for that. Just realize that hospital staff are not going to be those witnesses. I have not yet found a hospital that will allow their staff to be a witness to a document while they're a patient in the hospital. So they need to take care of that. And if I'm, again, talking with the signer or I'm talking with the hospital staff, I want to make sure that if witnesses are needed, that that is arranged, or they've determined they're not going to use them. Now, some states, for an advanced healthcare directive, need a special witness. They might be called an ombudsman, which is a patient advocate, and they would meet with the client and go over the document with them and make sure this is what they want and they understand it and they're aware. That's great news, because that's helpful for me. But the requirement isn't in a hospital. That requirement is in a skilled nursing facility only. So check your state. It might be in probate code to see if an ombudsman is a requirement for advanced healthcare directives when somebody's in a long-term care facility. All right, so I think we've worked through the document pretty well now. That the signature is going to come up in a moment. That's the only thing I haven't addressed yet on the document. Let's talk about awareness. The signer must be alert and aware when they're with me. The signer cannot be under conservatorship, and that might be a question you want to ask when you're on the phone confirming the appointment or talking to hospital staff. Conservatorship means they no longer have the right to sign for themselves and somebody else is signing as their representative. That's very different than a power of attorney document. I might have a power of attorney document that says my spouse can sign for me, and I'm just sharing the power of my signature. I can still sign for myself should I choose to do so. The signer cannot be under any medical orders that prevent them from signing legal documents. So if you get in there and you suspect something's not right, go back out to the nurse's station and see if they can assist you to know, is there any reason they're not able to sign legal documents today? Family are not forthcoming about these details, so you have to seek it out. Now, if for any reason the notary believes the signer is showing lack of awareness, right? They're not able to communicate with me directly without assistance or interpretation. They seem confused. They're reluctant to sign. The signing can be stopped whether or not there's a medical order or any other things going on. I can always stop that signing if I don't believe I have an alert and aware signer who's signing of their own volition. So now let's come back to the document for a moment regarding signatures. Check your state guidelines for options if they can't sign their name, as it would be on their ID. So in some states, Kansas would be an example of that. Anything they write, even if it's just a mark, will be considered their signature. It's the intention behind the signature that matters. Other states, like California, for instance, says, all right, there's a signature by mark procedure. They can make any kind of mark they want, but we need 2 witnesses that are impartial to watch them making the mark. And one of those will write the name of the signer next to the mark. And then underneath, both witnesses will sign their names along with the word witness, which is their role. And because we are required to have a journal, we would include the name of the or signature of the signature by mark witness in our journal, probably in the notes or additional information section. Now, there are a few states where a proxy, right, a replacement signer could be used. This means the signer's not able to even manipulate a pen to make a mark, but they can designate a third party to sign. Now, they might have to designate the notary if that's your procedure, or they might have to designate somebody else and the notary's watching this happen. And there is specific verbiage that goes at the signature line reflecting that this was done at the direction of the signer. So make sure you know what the state code says and what that extra verbiage should be on the signature line. Now, any mark, if they're just going to stop with a mark, can be made including a fingerprint, right? Any mark. It's the intention behind it. And the signer can have some assistance. If it helps the signer for you to point where in the document they need to sign, that's fine. If they need you to hold a clipboard up to them so that it's being held and they don't have to worry about holding that and working with the pen at the same time, that's fine. If they need help with getting their hand to the right place because they're having some vision issues, that's fine. But remember, you have to let go. They have to actually create the signature on their own. So these 4 areas are the most important to ensure we have a successful notarization. One is we've got proper identification so we can positively identify that signer. The other one is that I have a completed document. The third one is that they're alert and they're aware. And finally, that there's a signature process going on that meets your state requirements. Now, here's the summary, one-page summary that you could use. And again, you would modify this and take out the options because you just want what's appropriate for your state. And now they have something that's 1 page, easy to deal with, that they can pull out anytime that they need it. And, you know, you might be wondering, why would they want the training? Why do they care? I'm going to tell you, patient experience is very, very important in the hospital industry. They are surveyed and rated, and they want higher ratings. So it's to their benefit that there's a successful outcome in terms of notarization. And it's to their benefit to work with a notary who's interested in what's best for the patient and what's best for the environment, for the hospital as well. And that means understanding when I'm coming there and that I avoid mealtime and I avoid shift change, that I follow any house rules they may have. I might need to check in with the nurse's station before I go into the room. So those are things we want to make sure we communicate during that time so we get some good feedback about the best way for me to interact with patients and not interrupt the treatment plan going on. They will be very receptive to that. And who's the notary they're going to want to use when they're asked to get one? One that they know, like, and trust. One that provided help to them so that it's successful. One that is interested in what's the best way to make this happen in their environment. Now, if you're interested in downloading a plain, unbranded training, then go ahead and go to my website, coachmelora.com/resources. And you can download the PowerPoint and 1-page summary. And you'll see it's very plain, black and white. That's so you have the room to brand it, to use your own symbols, and to pull out or add in what's appropriate for your state. So you may not have realized that this was pre-recorded if you watched it during the premiere, but I am live during the premiere answering questions in the chat room. But if you have other questions after the premiere and you want to reach out to me, you can reach me at Laura@CoachMeLaura.com. You can reach me for a quick call, and that's at my website, CoachMeLaura.com, and you can schedule a 15-minute free call with me, and I'm happy to talk to you and give you guidance about that as well. So I hope this was helpful for you, and I'm excited that other notaries want to know how to grow their business through medical facilities.